call. Can everyone hear me okay? So hello, happy World Toilet Day, everybody. Good evening to all of our friends in the US. And then I know we have people joining us from Vietnam and the Philippines, and so good early morning to you. So my name is Van, and I will be facilitating this session of climate change, COVID-19, and the Mekong, the first online briefing of Thrive Networks in East Meets West. And our program offices in Vietnam, Cambodia, and Laos. Let me begin today's event by briefly just going through the agenda real quick. So first we will have opening remarks from our chairwoman, Ms. Melinda Griffith. After that, we will have a presentation on some of the women-led initiatives in sanitation and hygiene in Vietnam, Cambodia, and Laos by our CEO, Ms. Linh Foden. And then we will dig into some impact stories, which Ms. Han Nguyen, our Vietnam country director, will help us walk through. And then after that, we will have Q&A session. So again, if you have any questions for any of the speakers, throw them in the chat, and then I will collect them and ask them at the end of the session. So to help kick us off, I would like to invite Melinda to share her opening remarks with us, and we will start the webinar now. Thank you.
Fantastic. Welcome, everyone. I'm Melinda Griffith, chair of the board of Thrive Networks, and I really want to express my great gratitude that on this World Toilet Day, you are joining us to hear more about the efforts of Thrive Networks and East Meets West in Cambodia, Laos, and Vietnam. Our focus is on constructing and empowering women-led initiatives to address clean water and sanitation, climate resilience, and then now this year, COVID. I just want to give you two quick stories of my experience. Earlier this year in March, actually days before the shutdown, I was in Laos with our Laotian staff and as well as Linh Foden, and we visited village water projects that we had implemented and had also hoped to implement this year. The ones that we have implemented, we visited 5 villages along the Mekong River, very poor, very rural, very underserved area, and saw the quite large, quite significant, quite well constructed clean water project that now for the first time delivers water to almost 5,000 residents of these 5 villages along the Mekong River, which has created an amazing difference in the quality and the health of their lives. But also, more importantly, or as importantly, we visited the schools in the area, and to see a building that East Meets West had constructed on the primary school that contained 5 flush toilets, and then quite an extensive hand washing area outside those toilets for school children to use. And it stood in stark contrast to the villages we visited the next day outside of Long Prabang, of a system which we had hoped to construct with the help of Charity Water. This year, we're a little delayed because of COVID, but the need was demonstrated to be so great because it was the dry season and there was no water, no running water in any of these villages. It all had to be carried up quite a ways from the Mekong River. And we visited the school where we hope, where we plan, and we will construct a similar building. But in the meantime, the latrines basically were 2 wooden stalls that were not hygienic, that basically were buckets. And the children had to use these buckets and empty their own buckets. And there was no water, running water in the school, so there were no hand washing stations. And the contrast of the two has stayed with me all year. And the benefit that we can bring with your help, with our funders' help, and working with local and government officials in really implementing these kind of clean water systems. And just another story, and that was about a year or so ago, I traveled to Cambodia with our East Meets West Cambodian staff. We went to villages in the Battambang province to work with the women of the Cambodian Women's Union to meet several villages to talk about the benefit of households' hygienic latrines, and to visit households that had installed them with our help and with the help of our funders. And seeing for those who had installed the toilets, the pride, the dignity, the difference in the life in their lives that these household latrines had effectuated. And I was embarrassed to say that it really hadn't resonated with me, the difficulty and the challenge of women and girls and the disabled to, in the rainy season at night, to have to use fields, to have to use fish ponds for open defecation, not just from a hygiene and a personal dignity, but also personal safety, particularly teenage girls needing to have to go out at night in the fields. So I'm very proud of the work that we do. We really do strive to have a knowledge and learning component of all we do. We work very closely in public-private partnerships to implement and create sustainable and scalable change. And again, I welcome you. I'm so pleased to be with you. And now I turn it back to Van, who will introduce the Chief Executive Officer, Lynn Foden.
Thanks, Melinda, for sharing those very personal stories of what you've seen in Laos and Cambodia. So I'm going to turn it over for the meat and potatoes of today, right? I'm going to turn over to Ms. Lynn Foden, who will walk us through the women-led initiatives that East Meets West is doing, even amidst, right, the challenges of COVID-19 and climate change and how they're shifting and adapting. Thanks. You're on mute, Lynn, I think.
Okay, there we go. I knew I would have at least one small technical glitch, and hopefully that is going to be the only one. Yes, Happy World Toilet Day. It is really a thing. It is an official thing. It started in 2001. Because it's so important to raise the global awareness around the sanitation crisis. And as Melinda mentioned, sanitation does have such a huge impact on health, particularly on women and children. And it's very appropriate for us today to be focused on climate change, COVID-19, particularly within the Mekong, because this year's focus for World Toilet Day is on sustainable sanitation and climate change. And that's what brings us all together here today. But before I go through some of the details, I want everybody to just close their eyes for a second. And I'm actually going to get a little bit personal with you here. Because with your eyes closed, just imagine at some point today, I'm fairly certain that you used the toilet in your house. You found it there, or maybe it was in your office, it was just down the hall, it was next to your bedroom. You went in, you sat down, looked around, thought about your day, maybe saw a little dust bunny in the corner. You were done, you flushed. Water came out, all good. You stood up, you walked maybe a step or two to your sink. You picked up a bar of soap. Or maybe you've got like that foamy soap. It smells nice. You washed your hands, all good. You went back to your desk, you went back to your room, whatever it was that you were doing. And think about it. It was so easy. It was right there. It was accessible to you. And what we want to do is we want to make that accessible for all. Because as you'll see today, there are a lot of challenges for this to happen. So, as Van introduced, we've got a number of speakers. We're going to show a couple of films that will really bring home the messages. Let me tell you just a little bit more, some things that might shock you. Over 2 billion people don't have sanitation. And when you think about it in the context, in the countries in which we're working, in Vietnam, Laos, and Cambodia, Vietnam is one of the most vulnerable countries in the world to climate change. What does that mean? It means rising tides. It means more frequent storms. So Vietnam has tremendous vulnerability. So does Cambodia and Laos. And in Southeast Asia, there have been over 1 million cases of COVID. Now, when you put all these factors together, it's very difficult to have sustainable sanitation and good health and hygiene. So we at East Meets West, that's how we're known in Southeast Asia. We're part of the global network, Thrive Networks. So we are a pioneering organization to empower the poor and the most vulnerable. We focus on social inclusion. We do this through many public-private partnerships, through output-based aid. We have a number of water and sanitation programs that have been running for years. We also focus on community development. And thanks to our partners, which includes the Gates Foundation, KOICA, which is the Korean government assistance, USAID, US government assistance, DFAT, Australian government assistance, and foundations such as Charity Water, Dubai Cares, but also really importantly, hundreds of individuals like yourselves who help to contribute to these efforts, because it's only as we work in partnership. Let's look a little bit at some of the issues that we're facing as we're trying to address sustainable sanitation. The first one is climate change. Just this year in Vietnam, over 90,000 people were displaced because of the flooding. There's been increases in temperature, worsening droughts, flooding, rising sea level, much more intense storms. And as you can imagine, the terrible impact this has on sanitation, flooding of latrines, waste management systems, difficulty of access. So climate change is a huge issue, and it's compounded along the Mekong because there is such sensitivity in the levels of the Mekong River. So the populations that are living along the Mekong are significantly more vulnerable than other populations. And again, it's women and children who are disproportionately impacted by that. When we look at COVID-19, while globally there has been a tremendous toll, and certainly we know here in the US, fortunately, in Vietnam, Laos, and Cambodia, the actual cases of COVID were relatively small. The countries were able to manage it fairly well. But what has been devastating is the economic impact that has occurred. School closures, business closures, economic slowdowns. So that has made it significantly more difficult for the vulnerable populations. What we've been doing to address this has been through women-led hygiene and sanitation programs. And over the course of the work that we've been doing, 259,000 families now have access to hygienic latrines. Over 6,000, almost 7,000 partners have been trained in sanitation marketing and hygiene. And over 11,000 households have been connected to water. So these are big efforts that have been made, but they're always focused on having gender equality, social inclusion, and making sure that any of the infrastructure that we're doing is climate resilient. Here are just a few examples of some of the work that we've been doing recently to address not only climate change, but COVID-19. In the top left, you'll see some of the emergency relief work that was done in Vietnam, because supplies were desperately needed to get out to communities who, as you can see, literally staff and volunteers from the Women's Union were going out in canoes, little dugouts, to be able to deliver emergency supplies. In the top right-hand corner, we've got a school in Laos where all of the students received, and the teachers received, hygiene education training. They received little hygiene kits and learned good practices. One of the things that was really great when we talked to one of the teachers in Laos is the fact that she felt after the training, she'd been worried about going back to school because she didn't know how she was going to be able to keep herself or her students safe. And what if, if she brought the disease into schools, or if kids were transmitting it? And one of the things that she said after going through the training, which was so cool, was that she felt a lot more confident in going back into the schools, because she knew then that she had the tools to be able to work with her kids to be able to keep them safe. In the bottom left-hand corner, and hopefully the lefts and rights are the same on your screen as mine, but in the bottom left-hand corner, this is a program, they're called Happy Taps. And this was part of an emergency response program to be able to bring clean water for washing hands into schools. And this was part of the Australian funded work. And so as you can see, it was a fast, easy way, kid-friendly. They've got the education little pictures on there to show kids, to nudge them so that they know how to wash their hands properly. Then in the bottom right-hand corner, this was in Cambodia. And again, we were bringing out hand washing devices that would be accessible even for the handicapped. We also are working on longer term solutions because we know that there's the emergency now, but we want to make sure that the infrastructure, the training, the partnerships are there for the long term. Top right-hand corner. Oops, sorry, that would be the L for the left-hand corner. Top left-hand corner is one of the water projects in a school in Vietnam. And so it's setting up RO water filtration systems and providing taps for kids to be able to wash their hands and having clean drinking water. In the top right, we'll talk about this a little bit more, but this is our country director along with the Women's Union. And this really highlights the partnership that we have with the Women's Union in Vietnam, because that's the only way that we'll be able to have sustainability, is having the Women's Union. Over 6,000 Women's Union members have been trained as community mobilizers in order to be able to get the message out to all communities. Bottom left-hand corner is one of the water systems that that Melinda was talking about. So this is at the very top of it. Maybe not quite the right picture to demonstrate it, but it does show sort of the scale and the breadth. So this is a system that does provide water for 5,000 communities. And this is where we were visiting with the Vice Minister. Then on the bottom right-hand side, that's one of our climate resilient compassion homes. And so these homes are built in a way that can withstand floods, high winds, and provides a safe home for community, for a family. So these are just a few of the examples of the kind of work that East Meets West is endeavoring to do to help to mitigate the current risks with climate change and COVID, and to build long-term solutions. Now, what we're going to do is I want to tee up a short video, because we've been talking about sanitation and some of the difficulties. And if you've ever been in sales, you know how hard it is to convince somebody to do something. Well, just imagine, and you don't have to really imagine because you're going to see it now, but how hard it is to convince somebody to build a latrine. And what's amazing here is the army of women who are going out in all kinds of conditions to work with families and communities to transform their lives. I'm not going to talk any more about it because it's much more powerful when you actually watch the video yourself. So let's spend a few minutes and see the difficulty of selling latrines door to door in Vietnam.
Chúng tôi sẽ hỗ trợ anh chị tiếp cận nguồn vốn vay. Chúng tôi sẽ hỗ trợ anh chị tiếp cận nguồn vốn vay. Chúng tôi sẽ hỗ trợ anh chị tiếp cận nguồn vốn vay. Chúng tôi sẽ hỗ trợ anh chị tiếp cận nguồn vốn vay. Nghe đợt này nó tính cưới dâu mà rồi bằng nhà bự nó vận động làm cái nhà vệ sinh cho nó sạch, nó sẽ đẹp đẽ rồi lên mình dâu về để có cái nhà vệ sinh cho nó đẹp nha. Nếu mà chị cố gắng chị làm á thì chúng tôi sẽ hỗ trợ cho chị một nguồn vốn vay từ 9.672.000 mà chị trả dần hàng tháng. Thì mỗi tháng á, là chị trả 560.000 hàng tháng thì chị trả khỏe lắm. Ủa thứ Tư, mới tới chơi hả? Lúa thóc xong chưa mà đi chơi hả Thiếm? Chưa. Vậy hả? Rồi, tụi nó đi nay làm gì Thiếm?
Tụi nó nay đi cắt lúa.
Nó cắt lúa hả? Nó đi chừng nào nó mới về?
Chiều chị.
Chiều mới về.
Chiều chị về thì gặp nó đi.
Thôi vậy cũng được.
Dạ.
Để chiều thì tôi trở lại thì tôi gặp nó.
Dạ.
Anh viết đẹp dữ vậy đó hả? Trời ơi, giỏi dữ hả ta? Này ngoan cho bà ngoại đó, bà thương nha con. Vậy thôi, vậy tôi xin phép Thiếm tôi về ha.
Thôi chị về.
Này bà Chính về nha con. Bà về Thiếm Tư ơi. Chị em nào có nhu cầu thì làm cái nhà vệ sinh mà bằng 3 cái hầm 3 ngăn tráng đáy mà xây gạch 20 này thì bà con mình cứ liên hệ với Sang. Tôi xin giới thiệu Giang ở bên giám đốc Đại Thành để qua giới thiệu cái gì cái sản phẩm mà cái bồn nhựa.
Ở đây thì em có một cái đầu vào, khi nó lọc lắng xong thì ở bên này chỉ là nước thải ra thôi.
Không tiền lấy gì làm.
Tụi tôi sẽ cho chú Thiếm tiếp cận một cái nguồn vốn vay để cho chú có tiền để chú làm.
Vay được nhiêu chị?
Cái số tiền cho tuyển như vậy là Thiếm thì như nếu mà Thiếm vay mà 5.625.000 thì một tháng đóng 330.000, 24 tháng nó sẽ tất hết mà nó còn dư lại tiết kiệm lại nữa.
Dạ, mà ngang giờ ông lăn hàng đi.
Thôi giờ nói vậy thì cũng tùy bà dai dai làm.
Đó ông gợi ý vậy bà chịu đi.
Rồi chị về làm ha.
Chị chịu nha chú ba.
Đâu cũng được hết trơn á.
Thôi vậy nha.
Rồi,
Thôi vậy là tôi cảm ơn chú Thiếm. Thôi vậy tôi nhiêu đó hàng tại năm nay chúc mùa lúa trúng nha. Thôi tôi
Cảm ơn
xin
chị.
phép chú Thiếm tôi về ha.
Dạ, cảm ơn.
So what you just saw there was a short documentary film made by a director named Morgan Hummer. And it depicts the day in the life of a Vietnam Women's Union volunteer in the Mekong Delta. So now we wanted to turn towards those very sort of personal impact stories. Like you can see the scale of these women-led sanitation and hygiene programs, right, in Vietnam, Cambodia, and Laos. But now to share the sort of very personal, sort of the back side of the story, I'd like to invite Ms. Han Nguyen, the Vietnam Country Director of East Meets West, to share her insight.
Okay, can you hear me well? Thank you everyone for being here today, and it's my pleasure to talk to you at this event. But also, I have to say that I really appreciate your time, because we work with these women unions members almost like every day, and I just met her yesterday. We brought her from Bến Tre to Hòa Bình province for an exchange visit to see the projects in Hòa Bình province. So she's become one of the Miss Chung. Đỗ Thị Chung is one of the 17 million women union member in Vietnam, working as a village promoter in Tân Xuân Commune, Bến Tre. And she advised women in her community on building hygienic latrines and motivate other volunteers in 323 communes in the project. And this project, the film that just documented, is the project named Community Hygiene Output-Based Aid, that funded by Gates Foundations. And of course, as you can see from the film, like she works as a sanitation marketers, sanitation coordinator and promoters. But she wore chains about sanitation marketing and do sell the toilet to the rural household in her communities, thanks to the project. And yes, we also like facilitate to have partnership with the private sector supplier, such as the private company named Tân Á Đại Thành, and who manufacture the plastic septic tanks. And of course, there are more and more other private sector suppliers as well who participated in the projects. So as you know, Vietnam has one of the fastest growing economy in the world. But in many communes and remote villages, not every household have a hygienic latrines, and defecating in the backyard or in a nearby river with a fish pond latrine is become, still a practice. But obviously you can see it's not convenient, it's not safe in bad weather condition, especially for women, children, and elderly. So, and of course, disabled people. And this is a public health risk, but also a threat to the environment. So in Vietnam, in our cultures, not only in a traditional village household, but also in urban household where I live, Vietnamese woman is always the forefront of the issues raised by this practice, because they have to take care of family health. They have to take care of the elderly or the sick in the family. And on the other side, we believe and we prove that they are also a part of the solutions. And the film show a woman union volunteer, Mrs. Chung. She become an actor, but also a key to connect family with private supplier to a local financing options. So she also worked as a loan agent for different credit fund or the in-house financing product or the revolving fund run by the women unions. So in this work, they also not only, we have the facility that constructed by the private sector, but the household, they have to pay for that latrines. So the ownership and the behavior change will be ensured afterwards, instead of like providing a free latrines to the household and they have no ownership of that latrines. So this is the approach that we apply here, is a demand-driven approach and focus on sanitation marketing. And of course, through our interventions, these volunteers, they are improved their confidence, their status at household level, but also at community level. So empower women in order for them to do a better job in sanitation promotion, but also to support the community to have a better sanitation, and of course, public health is the main outcome. And in the face of COVID-19, so East Midwest and our world unions partner and the other government partner, we also, thanks to the Water for Women projects of the Department for Foreign Affairs and Trade by Australian government, and we have implemented the woman-led COVID-19 response plan, which support the disadvantaged household and the health worker in 173 communes, especially 50,000 the kindergarten kids benefit from our hand washing with soap interventions in collaboration with Habitat, as you can see from Lean presentations. So about the next film that we want to talk about is the film that we produce with great support from Morgan, and we will document again about one of the family who become the beneficiary of our woman-led sanitation program funded by the Water for Women. And you can see the family have been supported to build an accessible toilet. And in the family, there's Mrs. Burr, is the disabled people, the disabled woman who is blind and walk on the prosthetic leg, and Mrs. Burr is grow older and older. So her niece is Mrs. Yến will give her, will have to give up her job and stay at home to look after her aunties. And with support from East Midwest and World Unions, Mrs. Yến can build a hygienic and accessible latrine for Auntie Burr to use. And then she can gain, like daily convenience for Mrs. Burr and herself. And Mrs. Yến is very happy to resume her work and earn money to support her family. So Mrs. Yến family is one of 28,000 households will benefit from East Midwest woman-led output-based aid program in Vietnam. And we aim to improve water, sanitation, and hygiene conditions for disadvantaged people in rural areas, empower women by making them to become a changing agents, and make sure that no one is left behind, especially the people with disabilities. So we want to give a special thanks to the financial support of the Australian Department of Foreign Affairs and Trade, and also the collaboration with the world unions and the local government partner. So for these projects, we also improve, increase the engagement and involvement of the local government partner, and they will work with us very closely, and the World Union member very closely, in order to identify the most vulnerable household who are still in need of the hygienic latrine and water supply, and then they co-finance with all the support that we call output-based aid, smart subsidy, to support the most vulnerable and poor household. So let's take a look at the short film now, and I pass this back to chị Vân.
Mời quý vị theo dõi tạp chí Kinh tế.
Đi luôn là cái thềm này nè nghe, là cái thềm mà không đường đi xuống bằng thiên á. Đó, đi từ từ. Này, mấy năm trước á, thì mẹ tôi qua đời, rồi bỏ dì tôi thì bị tàn tật, rồi sống với tôi. Rồi bởi vì tôi thì bà nuôi tôi từ nhỏ đến lớn, nuôi tôi ăn học. Rồi, cho nên đó cũng là bổn phận của tôi chăm cho dì. Nhưng mà mỗi tháng thì có tiền trợ cấp của người khuyết tật. Rồi con tôi thì nó cũng mỗi tháng nó cũng cho được chút đỉnh, nhưng mà việc chăm sóc gì thì nó cũng không có dễ dàng. Đó ha. Đúng rồi đó. Rồi ngồi xuống giường bình thường đi. Rồi bàn nè, cái bàn đây đó. Rồi giờ bà ngồi đây nghe, tôi mà công chuyện nghe. Múc cho bà uống nước đi. Nhúc uống đều khát nước phải không? Trước đây thì tôi cũng thường đi ra chợ buôn bán thì mua bán đồ vặt vặt ở ngoài chợ á. Rồi có khi thì cũng có khi chị em cũng tranh giành mua giành bán giật. Nhưng mà mỗi ngày thì tôi cũng kiếm được từ 70 đến 100 ngàn tiền lời. Thì do đó cho nên gia đình tôi cũng đủ sống. Mỗi năm thì cũng mẹ con dì cháu và còn bà cháu cũng có cái Tết vui vẻ, ấm no hạnh phúc.
Lộn luôn đi. Đây, tháng 15 ngàn. Đây bắp đi.
Em tên là Võ Thị Kim Hà, hiện tại đang là chủ tịch Hội Liên hiệp Phụ nữ xã Phong Mỹ. Thì em công tác hội nay được 8 năm.
Từ năm ngoái đến nay thì vì tôi đã yếu dần đi rồi. Hội phụ nữ xã thì thường tới lui thăm, mà lần nào cũng có một cô tốt bụng đến thăm và khuyên bảo tôi giờ làm nhà tiêu an toàn và thiết thực hơn. Cầu cá. Rồi chiều nay ăn cơm không?
Thôi ngán rồi.
Ngán rồi hả? Rồi mời sáng ăn bánh không? Sáng ăn bánh thì chợ mua.
Để mà khắc phục những cái mà khó khăn trong khi đi vận động, cụ thể ở nhà chị Yến là như là trước tiên thì mình cũng phải là kiên trì nhẫn nại đi tới vận động cái hộ đó nhiều lần. Trước tiên khi mà tới hộ đó thì trước hết thì mình phải giải thích được cho cái hộ đó hiểu rõ về cái lợi ích của cái việc xây dựng nhà tiêu hợp vệ sinh. Trước hết là mình cái đó là cái lợi cho cái bản thân của những thành viên trong gia đình mình sử dụng trước. Thì bên cạnh đó thì nó cũng góp phần bảo vệ môi trường trong việc mà thực hiện cái tiêu chí môi trường mà để xây dựng xã nông thôn mới. Về cái thứ ba nữa thì ở bên đây thì hội cũng sẽ giới thiệu về các cái nguồn vốn mà hiện tại bên hội đang quản lý để cho các cái hộ dân mà người ta có thể tiếp cận được, để từ đó mà người ta có tiền để người ta xây dựng được một cái nhà tiêu hợp vệ sinh.
Bữa nọ ở hàng xóm rủ tôi đi họp, rồi tôi mới đi qua tôi họp thì tôi thấy 6 nhà kế bên láng giềng đều có nhà vệ sinh an toàn, thì thực thấy họ cuộc sống rất là dễ dàng. Rồi nhờ hội phụ nữ với thợ xây giảng giải cho tôi, rồi tôi thấy đó cũng là lợi ích, cho nên tôi mới quyết định xây. Nó cũng là lợi ích cho cả dì và gia đình của tôi. Lại chút nữa, lại chút nữa. Đây rồi ngồi xuống đi, chụp hình. Rồi lại đi. Thấy không? Bà chịu cả lương ha, hài. Cả lương bắt cả lương coi, nghe. Rồi giờ bà ngồi đây bà nghe nghe. Tôi đi rửa đậu lần nấu. Rồi giờ cái già tiêu, giờ tôi đi bán hàng ngày nào cũng đi rất là vui, khỏe lắm. Nay tôi đi ngày nào tôi cũng ra chợ tôi ngồi tôi bán hết, rất là vui.
Về phương Nam lắng nghe cung đàn, thổn thức vọng dưới trăng mơ màng. Rồi theo sông Cửu Long nhớ nhung dân tràn. Chợt thương con sáo bay xa bay, sương khói buồn để lại lòng ai.
Okay, thank you very much for joining us. So far we've gone through basically a presentation of East Meets West women-led initiatives, right, in hygiene and sanitation during the times of COVID and dealing with the impacts of climate change. And Han has shared with us some of the personal impact stories. And now we're going to turn towards our live Q&A session, even though I see that you guys have already started it in the chat. So I'm going to invite Lynn and Melinda and Han to unmute themselves and then answer the questions verbally. So I think what we see is there's a few questions around the idea of what kind of toilets, right? And from Albert and from Scott, how those sort of choices were made on the costing of that. So maybe Han, if you can, Han was the program part of the program design team across 3 countries, Vietnam, Cambodia, and Laos. And so Han, maybe if you can answer some of those questions on how those partnerships were put into place and what was decided in terms of what was locally appropriate, I think that would be interesting.
Yeah, so we talk about the partnership before we talk about the latrine options that people asking about, right? Sorry, I cannot control myself because I'm the, you know, the practitioner that already jump into the technical.
The engineer in Han. The engineer is coming through.
Yeah, okay, I have to respect the moderator. Yeah, so for the partnership is when we start our work in Vietnam, we also like have some kind, you know, like partnerships analysis of different suitable partner for our interventions, especially for the one about sanitation program, because we have done the, I think we have implemented and pioneered the output-based aid approach for water supply since early 2000s. But until like 2007, we have found, you know, some potential to apply output-based aid approach, the one of the result-based financing approach in sanitation programs. And at that time, there are several potential partners to implement the projects at local level. And there were health workers who work as a village health worker, and also at you know, they have own the branches and they managed by the Ministry of Health. They work under the Ministry of Health, and they also work with the CDC, the CDC, the Center for Disease Controls at provincial level. So many other NGO and organizations, they go to that way because they think that the Ministry of Health, the health worker, should be in charge of sanitation promotion, and it makes sense. It makes sense with the institutional arrangement and the capacity, and also on the you know, the structure in Vietnam. But we found out, you know, the health worker, they have a lot of things to do, and they also like sanitation is not the priority in their mandate, actually. Of course, they understand the outcome, the health outcome from the sanitation interventions, but in practice, like at local level, they are not like, you know, that persistent in order to go back and forth to the household. As you can see from the film, like Mrs. Chung have to go back and forth and visit the household many times in order to convince them, in order to persuade them and introduce to them about different options, sanitation options, and also the financial option for the household. And that the World Union, they can do very well. They can, because the health worker, when they come visit the household, they always say, oh, this is good for health. But in our monitoring system, but also from many research all over the world, you know, the health factor is not is not the key factor for their decision making. So health, it should go with convenience. It should go with safety for women and children, and and that's where, you know, and they also need to get advice and consultations about different financial options, so they can understand about what they can do with their financial capacity of that household. And then they can identify the gap that the household, okay, I only have a small amount of money, but the lodging cost is much higher than what I can afford. So the Wool Unions, we work with the Wool Union to introduce, we call this low cost, but it's, let's say it's affordable lodgings. And then they can, access to different financial products like the loan, the credit from different, like the Vietnam Bank for Social Policy. They provide the small loan for the sanitation products and clean water as well. And Wool Union is one of the loan agents for Vietnam Bank for Social Policy. And also they have their own revolving fund and credit fund as well. So that's the thing about, identify the potential partner. And of course, we also care about gender outcome out of that. And based on our research and study in collaboration with the University of Technology, Sydney, it shows up that, the gender outcome is obviously came out from our interventions. And last but not least, we also have to care about the burden on the Wool Union promoters when they're working with our projects, because they also have to, take care of their own family and their own job with Wool Unions. And yes, we also have to be cautious about how to not cause any harm or like more burden on their workload and their life. So make sure that we have programs that, can empower women, but not like put more burden on women. And the woman, they can empower the vulnerable woman, the less, the less advantageous woman. And that where it's work, and of course the Wool Union it proved to us that we made a good choice. We made a good, a right decision that we go with Wool Union instead of like working with health worker only. And of course, the health worker are still involved in our projects. So the CDC and the health worker now are trained about, how they can verify the lodging. They can do monitoring work for us. And we, because the output-based aid is like will be disbursed after the lodging are verified. And we also train the health worker about make sure that the lodging have become like, accessible lodging for the people with disability. And they make sure that, they understand about the need of the people with disability for a toilet that become accessible for them. So they have less, dependent on other family member to use the toilet themselves.
Great.
So that is a partnership thing. Yeah.
Lynn, I see what you're trying to do here. So let me just ask one more technical question from Scott, just to answer the questions on the household level, right? So Han talked a lot about the partnerships, which is really great, and the impact on our volunteers in the field, right, who are doing the sanitation promotion. But for the households, how much does it cost they're building a hygienic latrine, and then the process about the septic tanks, how much does it cost to empty it? How long will it take before it fills up? And is there a plan on this sort of bigger systems issue of septic tanks, right, in the program?
Great, thanks, Van. That it is one of my favorite things, fecal sludge management. So yes, I have to say it for the group here, fecal sludge management. How do we manage all of the stuff that ends up in these pits or septic tanks. It is a huge issue because containment and safe management of fecal sludge. So in Vietnam, as Han has described, it's typically within septic tanks that the families are able to purchase. It takes 5 to 10 years for those to fill up. And we're working with private companies in order to be able to set up a system for regular cleaning of the septic tanks. And a huge issue there then is on the dumping and having the proper treatment plant. So we're also working on, and we've been building with the support from Gates, one of the first fecal sludge management treatment plants in Vietnam. So you have that system there. When you go to Cambodia, there it's more hand dug pits, which have concrete linings in them. We're really trying to promote a double pit. So when one of your pits fills up, you can just switch and use the other pit. That way your first pit is composting, it's safe. So then either you or another trained professional, we do provide the training for the safe disposal. You can take that out of your septic tank and use it to feed your fish pond. But one of the things that we really focus on is that safe disposal of it, because it's not just the containment. And so when you think about the issues around flooding and climate change, that becomes a huge problem for fecal sludge management, because you have to ensure that all of the fecal material is contained properly, not seeping into the soil, not seeping into the water table. So it's a complicated issue and different, a little bit different how it's handled in each country.
And I think we have time for one more question, unless there are other questions coming through, but I think we have time for one more question before the end of the briefing. We have a question from Albert about microfinance. Is there a microfinance aspect to these programs? Has there been, etc.? Lynn, maybe you can speak to that.
Yes, there is. So in all 3 of the countries in which we're working, we have close associations, often with the Women's Union, who do have some kind of a revolving fund or access to credit. And so there is generally some kind of a payment plan. In some cases, the family is able, after a good harvest, to pay for everything at one time, but more often than not, it is a payment over time. And so, so we work through local, essentially credit unions, but we do have that honest broker who helps in working with the families for them to identify what credit options are available for them in the community. And it's generally the Women's Union member who is the one who helps to be able to educate and to be able to make that link to the financing.
That's great. I think that is it for the questions, but can I just ask all of our speakers maybe to reflect a little bit about the program and think about, what is the one thing that you want the audience to sort of take away from today, from the work that East Meets West is doing in the middle of this crazy year, 2020, with Women's Union and women-led sanitation and hygiene? What's the one thing that you want sort of the audience to take away before we go to closing? And I think maybe I'll start with Melinda first, and then Hannah, and then Lynn, we would do.
Okay.
Well, thank you. And thanks everyone again for participating. It means so much to us for the support of our work in Vietnam and Cambodia and Laos. And I'm very proud of the public and private partnerships we have created, including working with the Women's Union in all 3 countries to really empower them to become change agents, to empower them to make a difference, and to help design and implement these systems on a scale that makes a difference in many people's lives and really does create sustainable long-term change. And we welcome your support of our efforts in schools and in building climate resilient homes. A little goes a long way, and all the people I've met are so aspirational that if you create the opportunities, they will really embrace them. So thank you again.
Thanks, Melinda. Han, do you have one takeaway message for the audience today?
Is that for Lynn?
Just want to say,
Sorry,
yeah.
go ahead.
So I just want to say thanks to everyone, and just remember that a toilet is not just a toilet. I think the toilet can help a lot of women to have a better life, and it can, you know, the way that we provided the support to the household is the way that we can create more, you know, impact to many others women, not only in Vietnam but in other countries. Yeah.
Thanks, Anne. Lynn, you want to?
Great. Yeah, no, I think for me, one of the things, you know, even when I look at the screen here, because we're talking about, you know, women-led initiatives, and what, you know, we sort of walk the walk or walk the talk with, you know, with a female board chair, and then myself, a female country director. We look at our staff. And so, you know, we're trying to model within our organization some of the change that we hope to see on the ground level. And what's so inspiring, it is, you know, it is the women on the ground. It is the woman who's willing to go door to door and being chased by a dog, going through all kinds of circumstances. It's the family that is trying to find that way so that their aunt is able to have some dignity. And so when you see those stories, when you see those individuals, that's the thing that really inspires me every day. And I hope that all of you will join our community, sign up for the newsletter, learn more about the issues. There's a lot to learn. We're going to try to do more of these series and dig in more detail to one issue. Today it was kind of a broad brush. We touched upon a lot of different things because we wanted to whet your appetite about the issues, the causes, to inspire and motivate you to think about this more. We want you to volunteer, sign up. There are things that you can do. And of course, a little money always goes a long way. So those are three ways. You can get in touch with us directly and we can point you to the right kind of service and the way that you can help. Because we want to be able to, we want you to join us to build sustainable solutions and resilient communities. And thank you for spending this hour with us today. And we do hope to see you in future webinars. You can let us know if there are particular topics that you would be interested in, and we can do some deep dives. But thank you so much for sharing with us.
Thank you.
Very much, everyone. If you have any additional questions, you can email me and I will send it through to the rest of the team at van.ly@eastmeetswest.org. But have a very nice day. Happy World Toilet Day, everyone. And thank you for joining us.
Thank you. Stay strong and resilient.